Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them without losing your poise. This video is part of our bacterial infection series. Today, we're diving into two important but often overlooked gram-positive bacteria, Actinomyces and Nocardia. Let's kick things off with some questions to get you thinking. Which gram-positive rod is a normal mouth commensal, but causes abscesses when it invades deeper tissue? Which one is partially acid-fast and commonly lives in soil? How do you tell them apart on a stain? We'll reveal the answers shortly. Both Actinomyces and Nocardia are gram-positive filamentous rods. Under the microscope, they may look like fungi due to their branching structure, but they're definitely bacteria. But that similarity in appearance is where their overlap ends. Let's start with Actinomyces. The best-known species in this genus is Actinomyces israelii. Actinomyces is gram-positive, non-acid-fast, and anaerobic, which means it thrives in low-oxygen environments, such as deep body tissues. Normally part of the mouth, gut, and genital tract flora, Actinomyces becomes pathogenic when mucosal barriers are disrupted, like after dental surgery or trauma. Infections progress slowly, forming abscesses linked by sinus tracts. These tracts often drain sulfur granules, which aren't exactly sulfur but yellowish clumps of bacteria visible under a microscope and characteristic of actinomycosis. Actinomyces causes cervicofacial actinomycosis, often after dental work, where patients develop firm jaw swelling, sometimes called lumpy jaw, with draining sinus tracts. Pelvic infections may also occur, particularly in individuals with prolonged IUD use, and can present with pain, unusual discharge, or a pelvic mass. Abdominal or thoracic actinomycosis often follows gastrointestinal perforation or aspiration, causing persistent pain and fever. Thoracic cases may also include cough and pus drainage through sinus tracts or fistulas on the chest wall. Tissue or body fluid specimens typically contain gram-positive branching rods. Pus from infected areas may contain sulfur granules, which are a helpful diagnostic clue. Culturing Actinomyces can be challenging because it grows slowly and requires an oxygen-free environment. Treatment usually involves high-dose penicillin for several weeks to months, depending on infection severity. Doxycycline is a suitable alternative for patients allergic to penicillin. Now, let's talk about Nocardia. Human nocardiosis is most often caused by Nocardia asteroides. Unlike Actinomyces, Nocardia isn't part of your normal flora. It's a partially acid-fast, gram-positive, aerobic branching rod that lives in soil and dust. Nocardia grows worldwide, but is particularly common in warm, humid, and tropical regions like South Asia and South America. The microbe thrives in soil and decaying organic matter. People can inhale it, and it can also penetrate breaks in the skin and mucosal surfaces. Nocardia can be opportunistic, affecting immunocompromised patients, such as people with cancer, HIV, or chronic lung disease. In these groups, Nocardia may cause pulmonary nocardiosis, which resembles tuberculosis, presenting with cough, as well as lung nodules and cavitations. Hematogenous spread, when bacteria travel through the bloodstream, can produce brain abscesses. As mentioned, Nocardia may also enter the skin or mucosal surfaces after trauma, such as in gardening injuries. For example, Nocardia keratitis is a rare eye infection often arising from trauma, contact lens use, or surgery. Patients may have normal immune function. Nocardia keratitis presents with painful, red eyes with slowly worsening corneal ulcers, and requires prolonged antibiotic treatment to prevent vision loss. Lab tests of tissue and body fluid samples show weakly gram-positive branching filaments. A positive modified acid-fast stain is key for diagnosis. Cultures produce chalky white colonies, but growth may take more than a week. Systemic treatment typically starts with co-trimoxazole, with severe cases requiring combination therapy that includes imipenem or amikacin. For Nocardia keratitis, the first-line treatment is topical amikacin, often combined with oral co-trimoxazole for more severe or resistant cases. Now, Let's revisit our questions. Which gram-positive rod is a normal mouth commensal but cause abscesses when it invades deeper tissue? Answer: Actinomyces israelii. Which one is partially acid-fast and commonly lives in soil? Answer: Nocardia asteroides. How do you tell them apart on a stain? Answer: Actinomyces is gram-positive, but not acid-fast. Nocardia is weakly gram-positive and partially acid-fast. Did you get all the answers correctly? Cool! If you found this video helpful, hit like, share, and subscribe. You'll also find a downloadable table in the description that compares these filamentous bacteria. Thanks for watching. Watch out for our next video.